Hey there, I'm Dr. Mark. I'm a concussion specialist who's worked with hundreds of athletes, entrepreneurs, and everyday people to recover from concussion, post-concussion, and just get back to peak performance and recovery. So if you're struggling with post-concussion symptoms and you're wondering how long recovery should actually take, or if you're feeling frustrated by conflicting advice, this video is for you. Today, I'm going to break down sort of the real trajectory of concussion recovery. What should we actually expect about symptoms, and when should you expect to recover? What is post-concussion syndrome? When does that all actually happen? What are the benchmarks? Also, be sure to stick around to the end because I'm going to share some key rehab strategies. So let's dive in. So let's talk about general recovery timelines and what to expect there. First, let's talk about the good news, and that is the fact that most people will recover from a concussion in about 3 to 4 weeks. That's your textbook concussion, and that is as fast as, if not faster than, recovery from an ankle sprain. So there's a really cool study titled "Less than half of patients recover in less than 2 weeks," and what they found is that about 45% of people recover in less than 2 weeks, and I'm going to give a soapbox rant on why they actually didn't recover in less than 2 weeks. About 32% recover in about 4 weeks, and so when you add those numbers together, you'll find that 70 to 80% of people recover in about a month, about 4 weeks. Another 17% of people will take 4 to 8 weeks, and then a very small percentage of people, 5 to 7%, are going to take longer than 8 weeks to recover. But the catch is these recovery rates assume that people are actively managing their recovery. Part of the recovery criteria for this study, like who was recovered and who wasn't, was being able to achieve normal exercise tolerance. I can tell you that you don't achieve normal exercise tolerance by doing hibernation, cocoon therapy, strict rest. So a little sidebox rant here about 45% of people who recovered in less than 2 weeks. I call bullshit, and here's why. Those people either weren't concussed or they didn't actually meet the full recovery criteria. And the reason being is that when we look at the neurometabolic cascade and we look at the energy metabolism of concussion, we find that your brain actually goes through a little energy crisis, a little energy deficit, where brain energy levels dip about 20% over the first 3 to 5 days. And we see that those energy levels don't return to normal, don't return to kind of control baselines until about 21 to 30 days, maybe even longer after the injury. So we're looking at about a 3 to 4 week metabolic recovery from concussion. There's no way you're recovering in less than 2 weeks fully. You may be asymptomatic, but there's still stuff going on under the hood that hasn't resolved yet. So when does a concussion become post-concussion syndrome, or more current would be calling it persistent post-concussion symptoms or persistent concussion symptoms? The abbreviation still comes out to PCS. The answer is 30 days. So when we look at international consensus criteria, if your symptoms last, children or adults, if your symptoms last longer than 30 days, it's now classified as post-concussion syndrome, or again, persistent post-concussion symptoms, persistent concussion symptoms, blah, 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 blah. The studies show that if no rehab is taken up, if we just give you go to the ER, clean CT, diagnosed with a concussion, here's the paperwork telling you to rest and just gradually return to activity on your own, see you later. When we follow up with those people, up to 56% of those people are still going to be symptomatic, not fully back to work, not fully back to life at 6 months. This means that intervention is crucial. The takeaway from that study was actually, hey, maybe we should follow up with these people at 2 weeks and check in on them. And it's like, well, no shit. So the major mistake with all of this is strict rest. So the old advice was sort of intuitive. Like if you injure your elbow, take it easy on your elbow. If you injure your brain, take it easy on your brain. The old advice used to be rest until your symptoms go away. And what we're finding is that not only is it becoming outdated, but it's becoming outdated because it's potentially harmful. We have animal and human data showing that strict rest, hibernation, cocoon therapy, that can prolong, meaning make the symptoms last longer, and it can worsen symptoms. So not only can it delay your recovery, but it can make that recovery worse. What more and more research is finding is that when we intervene with early subsymptom aerobic exercise, when we intervene with early vestibular therapy, with early cervical spine manual therapy, faster recovery occurs. Go figure. So why do some people take longer to heal and recover than others? Some folks last several weeks, several months, even years. The answer lies in the symptom generators of concussion and whether or not your provider has actually assessed those. So there are 5 main symptom generators of concussion. We've got autonomic, physiologic, basically meaning your blood flow. We've got metabolic hormonal involvement. We've got visual vestibular involvement. We've got cervical spine involvement. And we've also got your psychology, your mindset, anxiety, depression, trauma overlap that sort of plays a factor in all of these. So when we look bullet by bullet, when we look at autonomic dysfunction or blood flow issues, part of the pathophysiology of concussion is altered blood flow, altered responses to blood pressure, to CO2, to autonomic activity. And when we fail to regulate blood flow, that can lead to headaches, head pressure, dizziness, nausea, all of it. So the solution here is getting orthostatic vitals testing, getting subsymptom aerobic exercise testing, getting that autonomic and blood flow system looked at so that you can actively rehabilitate it. The most evidence-based thing that we have up to this point is subsymptom aerobic exercise based on the Buffalo Concussion treadmill or Buffalo Concussion bike test. When we look at metabolic and hormonal issues, this is going to be much more nebulous, less clear-cut. This is going to be much more patient by patient. But generally speaking, we know that if we attack inflammation in almost any condition, we're going to see some improvement. Concussions trigger, there's a neurometabolic cascade that occurs, and that triggers not only inflammation in the brain because it is a brain injury, but it triggers systemic inflammation too. So I've done a video recently on the gut-brain axis after concussion. I just posted a video recently about hormones in concussion. And so what we see is that there is a metabolic role in concussion, but generally in the acute stages, if you attack things with proper nutrition, maybe some early supplementation with creatine, omega-3s, magnesium, different things that would be indicated in your case, and sleep hygiene, that's going to help regulate metabolic and hormonal side of recovery, especially early on, way more than you would want to give it credit for. When we look at the visual vestibular dysfunction symptom generator bucket, whatever language you want to use, we find that traumatic brain injury, mild, moderate, severe, we see that any form of traumatic brain injury, over 90% of patients are going to have an overt oculomotor deficit. And when you look at concussion, I don't have the percentages off the top of my head, but we've got a large percentage of people are going to have trouble with pursuits, a large percent of people are going to have trouble with saccades, with their VOR, with different oculomotor patterns. And that's going to lead to headaches, to dizziness, to nausea, to, again, all the concussion symptoms you can think of. And so the solution there would be initial screening with a vestibular oculomotor screening of VOMs. And then depending on what we find there and how you respond to early treatment, we may go into video nystagmography, we may go into caloric testing, other things, but for sure start with the VOMs. It's helpful in the diagnostic process for concussion, specifically for ruling out concussion. If you don't have symptoms on the VOMs, 92 to 96% chance you don't have a concussion. Moving on to the neck. It's either the only thing providers work on, and they usually work on it through like massage of the suboccipital muscles and chin tucks, which is super incomplete. And then on the flip side of that, we've got large, big name clinics that don't even look at the neck, which is crazy because the only way you can transmit acceleration, deceleration forces to the head is if the neck moves. So the neck has to be involved. And when we look at the G-force of concussion and the G-force of whiplash, the G-force of concussion far exceeds by like 15 to 32 times that of the force needed to sustain a whiplash, cervical strain, or sprain injury. Your neck is almost always invariably involved in concussion. And so the solution there is to have a proper cervical spine examination, not just is there pain, but looking at the proprioception, spatial awareness, and sensory motor integration of how your neck actually feeds back to your ability to coordinate head and eye movements, your ability to find out where you're at in space without visual information, and doing appropriate manual and visual guided rehab or whatever needs to be done from there. Last, but certainly not least, is your psychological overlap to all of that. Anxiety, stress, fear, depression around the injury. That can all amplify autonomic symptoms. There's strong literature behind sort of anxiety and vestibular disorder creating a chicken and egg loop. We know that family history of anxiety, previous history of anxiety, concussion fights dirty and kind of amplifies that. And when you mix that with Dr. Google information and conflicting advice from different providers, it can just set the whole thing on fire. So solutions there would be not ignoring the mental health aspect, not being offended at the fact that your anxiety might be playing a role in your lack of recovery. And that's not to say it's made up, it's in your head. It's to say anxiety is a modifiable factor that can make you feel better. Let's not ignore it. So cognitive behavioral therapy is one of the strongest research things in concussion. You can also do biofeedback. There's other things we can do, but not ignoring the mental health aspect of your recovery. Huge. So a key takeaway is that if you have PCS, you likely don't have just one of those generators. You likely have multiple. There's likely an autonomic, a visual vestibular, cervical spine, and maybe some anxiety. There might be metabolic, hormonal, and autonomic. There might be anxiety and vestibular. There's going to be a mix and match sort of symptom generator medley when we're going through your concussion, post-concussion assessment. But the really good news here is that each one of those generators has a multitude of treatment options that we can use to fix, improve, and get you back to feeling completely normal. So to recap here, most people are going to recover in 3 to 4 weeks, 20 to 30% don't, and they may need more targeted rehab. When it lasts longer than 4 weeks, that's when it's called post-concussion syndrome. Strict rest is not the answer at any point, whether you're early in your injury or you're years into your injury, strict rest is not the answer. If you're dealing with PCS, finding a provider who knows how to assess and address autonomic blood flow issues, metabolic issues, vision, vestibular issues, neck function, mental health, even just coordinating that care, even if they don't do it all themselves. I'm one of those people. I don't do it all myself. I do a lot, but I don't do all of it, especially not the mental health. I refer out to physical therapy all the time. I refer out to cardiology for POTS and things like that. But having someone who can coordinate that and navigate the assessment process and at least kick that off, it's going to be super helpful for your recovery. So if you like this, if you found this helpful, go ahead and hit the like, the subscribe, hit the bell for more science-backed concussion recovery tips. It's free for you. It helps my channel. I appreciate it. If you would like personalized recovery guidance, go ahead and check out the links in my bio. You can schedule consults. I've got a concussion recovery course. Go ahead and check those out. Drop a comment below. If you've been concussed, how long did it take for your concussion symptoms to improve? Did it match what we talked about in this video? Faster, slower? Let me know. Until next time, I'm Dr. Mark. See you.